Changing a pouch. Your child's entire one-piece and two-piece drainable pouch system will need to be changed every 2 to 4 days. If you or your child sees any output or leakage around the pouch, or if they feel any burning or itching under the barrier, change the pouch right away. Just how long a pouch system can be worn depends on how full you allow the pouch to get, the amount of sweat or perspiration, and how smooth or uneven the skin is around the stoma. Decide on timing. You'll also need to decide on timing pouch changes. For ileostomy and colostomy, it is easier to change the pouch when the stoma is less active, such as the first thing in the morning before your child eats or 2 hours after eating. Gather supplies. Changing your child's pouch system is much easier when all the supplies are handy, so the first step is gathering everything you'll need. A new pouch. Something to clean your child's skin, such as a damp washcloth or ostomy wipes. A sizing template to measure your child's stoma and size the opening. A pen to trace the size of your child's stoma, scissors for cutting the opening, and a small disposable garbage bag. Though your child may not need them, other supplies include skin powder to place on red, weepy skin, skin paste or rings to fill in any folds or gaps, skin barrier sealant to coat the skin so the barrier sticks better, and adhesive remover. Most barriers will adhere to the skin with no additional supplies. If your child's barrier is not sticking, talk to your child's doctor or nurse to help you problem solve. Okay, now would be a good time to pause and gather all of the supplies you would need to change a pouch system. After we show how to remove the pouch, we'll practice placing a new pouch on the ostomy practice model. Remove the old pouch. To remove the old pouch, begin by peeling away one corner of the barrier. Then work around the rest of the barrier, pushing down on the skin at each point while at the same time pulling the barrier away from the skin. Some people use a cloth or gauze to push on the adhesive as they remove the barrier. Lastly, place the used pouch into a disposable waste bag. Clean and inspect the skin. After removing the old pouch, look at your child's stoma and check the color. It should be red and moist. Also check for any bleeding. This is rare. Then check the skin around the stoma for any redness or irritation. Your child's skin should look like the rest of the skin on their abdomen. After inspecting your child's skin, clean it with water and a washcloth. Do not use scented soaps, oil, or alcohol. Then gently pat your child's skin dry. If the skin around the stoma is irritated or weepy, stoma powder can be applied to absorb the moisture. Remember that your child's new barrier will not stick well if the skin is moist. You may need to dab or spray the powder with a skin sealant or skin prep. Measure and cut the opening. Next, measure and cut an opening in the new barrier. Most skin problems are caused by the ostomy opening not being cut to the right size, so it is important to measure the stoma and make sure the fit is right. So let's do this together. You will need the stoma practice model, pen, measurement guide, scissors, and pouch from your skills kit. Measure the stoma. Use the sizing template and determine the size of the stoma. You should be measuring the stoma practice model. Find the size that fits closest to the edge of the stoma where the skin and the stoma meet. Next, place the template on the back of the pouch barrier and trace the correct size. Use the scissors to cut an opening in the barrier closely following the traced shape. If your child is using a one-piece pouch system, place your finger into the small pre-cut opening and push away the pouch before starting to cut. Be careful not to cut through the front of the pouch. If you do cut the pouch, do not try to tape it closed. It will leak and also emit odor. Center the new opening over the stoma to make sure it fits along the stoma edge. For the first several months, Your child's stoma will continue to shrink in size as swelling goes down. So in the beginning, you will have to measure your child's stoma with each pouch change to make sure you have the right size opening. After that, you will be able to pre-cut your child's pouch opening from your template or order pre-cut pouches. The opening should fit very close to the edge of the stoma to prevent skin irritation. If your child's stoma isn't perfectly round, work with your child's ostomy nurse or doctor to make a custom template. Applying the new pouch. Now you can attach the new pouch system. If you notice any skin redness or weeping, apply stoma powder before you attach it. Start by removing the paper from the adhesive back of the barrier. Next, center the cut opening over the stoma. Place the barrier on the skin around the stoma, hold it in place, and press down on all sides for about 30 to 60 seconds to make sure that it is firmly applied. Now, raise the bottom of the pouch and close the opening. Your child may wear a pouch belt to secure the pouch. You can date and keep the paper from the back to use as your template for the next pouch change. Okay, so let's pause as you measure, cut, and apply your child's pouch to the ostomy practice model.